Understanding the full scope of addiction. Addiction is defined as a chronic, complex disorder characterized by compulsive seeking and use of a substance or behavior despite adverse consequences. It's considered a brain disorder because it includes functional changes to brain circuits involved in reward, stress, motivation, and self-control. Some key medical aspects of addiction include changes in brain chemistry. Addictive substances and behaviors cause surges of dopamine in the brain's reward system, leading to reinforcement of the addictive behavior. Physical health consequences. Addiction is often associated with various health issues, including cardiovascular disease, stroke, cancer, HIV/AIDS, hepatitis, and lung disease. Comorbidity is a medical term describing two or more diseases or conditions within the body at the same time. Drug use and mental illness frequently co-occur. In some cases, mental disorders may precede addiction, while in others, drug use may trigger or worsen mental health conditions. Risk factors. Several factors can increase the risk of developing an addiction. Genetics. Family history of addiction can increase susceptibility. Environmental factors. Exposure to drugs, peer pressure, and lack of family involvement can contribute. Early drug use. Using drugs at an early age can affect brain development and increase addiction risk. Mental health disorders. Conditions like depression, anxiety, and ADHD can increase vulnerability to addiction. Treatment options. Addiction treatment typically involves a combination of approaches. 1. Medications. Certain medications can help manage withdrawal symptoms, reduce cravings, and treat co-occurring mental health conditions. 2. Behavioral therapies. These include cognitive behavioral therapy, motivational enhancement therapy, contingency management, and family therapy. 3. Support groups. Programs like Narcotics Anonymous can provide peer support during recovery. 4. Inpatient and outpatient treatment. Depending on the severity of addiction, treatment may occur in residential or outpatient settings. 5. Detoxification. This is often the first step in treatment, allowing the substance to leave the body under medical supervision. 6. Long-term follow-up. Ongoing care and support are crucial for maintaining recovery and preventing relapse. It's important to note that addiction treatment should be tailored to individual needs, as no single treatment is appropriate for everyone. Effective treatment addresses multiple needs of the individual, not just their drug use. Mood disorders. Addiction often co-occurs with and exacerbates mood disorders. Depression. Substance use can trigger or worsen depressive symptoms. The brain changes caused by addiction can lead to persistent low mood and anhedonia, which is the inability to feel pleasure. Anxiety. Many individuals with addiction experience increased anxiety, paranoia, and panic attacks. The cycle of intoxication and withdrawal can heighten anxiety symptoms. Cognitive impairment. Chronic substance use can impair cognitive functions. Memory problems, particularly with substances like marijuana, can negatively impact both short-term and long-term memory. Attention deficits are also common, making it difficult to concentrate and maintain focus. And decision-making skills often suffer, leading to impaired judgment and poor choices. Addiction interferes with normal emotional processing. Mood swings are frequent, with individuals experiencing rapid and intense changes in emotional states. Emotional numbing is another issue, where some may feel emotionally disconnected or have a reduced range of emotions. Increased irritability and anger can also occur, especially during withdrawal periods, leading to heightened emotional reactivity. Addiction can profoundly affect one's sense of self. Low self-esteem is common, with feelings of shame, guilt, and worthlessness, as well as a lack of meaning and purpose. An identity crisis can happen too, where the addictive behavior becomes central to one's identity, overshadowing other aspects of personality and interests. The mental health effects of addiction extend to social functioning. Relationship strain. Addiction often leads to conflicts with family, friends, and romantic partners. Social isolation. As the addiction progresses, individuals may withdraw from social interactions and activities they once enjoyed. Increased risk of other mental health disorders. Addiction can increase vulnerability to other mental health conditions. Psychosis. Some substances, like amphetamines, can induce psychotic symptoms or exacerbate underlying psychotic disorders. Suicidal ideation. The combination of addiction and mental health issues significantly can increase the risk of suicidal thoughts and behaviors. What some may not know about the stress response. Addiction alters the brain's stress response systems. Heightened stress sensitivity. Individuals with addiction often have an exaggerated response to stressors. Impaired stress coping. The ability to manage stress effectively is often compromised, leading to a reliance on substances as a coping mechanism. However, there are ways to manage stress effectively. Techniques such as mindfulness, therapy, and support groups can help. Building healthy habits and seeking support are crucial steps. With the right tools, with the right approach, and with the right mindset, managing stress without substances can lead to very positive outcomes. In conclusion, addiction has pervasive effects on mental health, impacting mood, cognition, emotional regulation, self-concept, and social functioning. These mental health consequences can persist even after substance use has stopped, highlighting the importance of a strong recovery plan, which includes comprehensive treatment approaches specific to the individual that address both the addiction and its mental health impacts.